Hi, namaskar dear students and good morning. Today we are going to discuss about one of the most important drug for Digoxin. This medication is very important with the exam point of view regardless of the exam that you are preparing for. FPG, NEPLEX, PBC, OPERA, whatever exam that you are preparing, you can expect question from the Digoxin. It is very important medication. So आज के क्लास में we are going to cover all the points that you must have to learn about the Digoxin with the practical point of view as well as the exam point of view. Okay, so it's a very simple and straightforward class. First of all, Digoxin is considered as a cardiac glycoside group of medication. Okay, why this medication is very important and unique? Because the mechanism of action is two unique mechanism of actions associated with the Digoxin. One is negative chronotropic effect. Okay, negative chronotropic, that means that is slow down the heart rate, and that is a positive ionotropic effect, that means that increase the force of contraction. So Digoxin increase the force of contraction and slow down the heartbeats. That's why Digoxin used for the management of arrhythmia. Okay, that's why that's used for arrhythmia. And increase the force of contraction, that's why this used for heart failure. That means two unique way of mechanisms, and due to that two unique user cases. Okay, first is Digoxin used for arrhythmia and used for heart failure. But the most important question is Digoxin is used for atrial arrhythmia, that means atrial fibrillation and atrial flutter. Most important question you can expect in your examination is the Digoxin can cause arrhythmia. Digoxin can cause arrhythmia. What kind of arrhythmia can cause? Ventricular arrhythmia. This is the very important side effect associated with the Digoxin. So far you have understood four different points. One is negative chronotropic, positive ionotropic. Used for arrhythmia, used for heart failure. Arrhythmia specifically atrial fibrillation and atrial flutter. But Digoxin is not used for ventricular arrhythmia because Digoxin can cause ventricular arrhythmia. Definitely you can get questions from this information. Okay, another very important point you must have to learn and remember: hyperthyroidism and hypothyroidism. When the patient is suffering from hyperthyroidism, logically and physiologically, patient has overactivity of the sympathetic system. Second is that increase the renal blood flow, that change the volume of distribution. All these changes that decrease the Digoxin level. So when the patient is suffering from the hyperthyroidism, always we have to make a correction in their thyroid function, and based upon that we have to adjust and change the Digoxin dose. Okay, so hyperthyroidism decrease the Digoxin level. This is very crucial and critical information for your exam point of view. On the other side, the patient is suffering from hypothyroidism. That means the patient has a relatively low sympathetic tone, and that increase the Digoxin level. Okay, so hypothyroidism increase the dose and increase the level, and hyperthyroidism decrease the level. This is very important point that you have to remember. Electrolyte, effect of electrolyte on Digoxin concentration and Digoxin sensitivity. This is very important part. Mainly you have to remember these things: hypokalemia and hypercalcemia. Okay, so in a simple and layman understanding, potassium and calcium. Okay, so potassium and calcium, when the potassium is making heart slow. Okay, because this is intracellular, and the calcium that is increase the contraction. Now, if the patient is suffering from hypokalemia, that means the low potassium level, that means relatively heart is responding more to the digoxin. Okay. On the other side, hyperkalemia that change the digoxin effect. Hypokalemia also change the digoxin effect. Hypercalcemia and hypocalcemia, these four different terms, and the digoxin effect, like digoxin sensitivity, this is very, very important part, because digoxin is acting on the sodium potassium channel. So sodium potassium channel, that means the contraction, force of contraction of the myocardial muscles will increase. Okay, if the patient is suffering from hypokalemia, in that situation, that significantly increase the digoxin sensitivity. And why this is important for your exam point of view? Because majority of the patients, those who are suffering from the heart failure, they are taking a loop diuretics. And loop diuretics are significantly change the electrolytes, and that's why that increase the chances of the digoxin sensitivity and digoxin effect will be affected due to electrolyte change. So hypokalemia can increase the digoxin sensitivity, and hypercalcemia, because calcium is also stimulate the heart, and digoxin is also stimulate the heart. So both are a stimulant, and that's why that increase the sensitivity of the digoxin. This is very, very important part, and you must have to remember. Okay, on the other side, hypocalcemia and hyperkalemia, that is also decrease the digoxin sensitivity. So this four terminology you must have to remember. Again, the potassium and magnesium both are similar way. Acidosis is also change the potassium shift, and due to that the problem of the increase the digoxin sensitivity. Another point, hypoxia, when the patient is suffering from the hypoxia, that change the ATP level, and this changing the ATP level, that change the sodium potassium pump functionality, and due to that increase the digoxin sensitivity. Okay, so if you can remember all these terms, that would be great. If you cannot, in that situation, potassium and calcium, what is the effect of hypocalcemia, hypokalemia, hypercalcemia and hyperkalemia. So this terminology and the digoxin sensitivity, this is very, 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 very crucial part, and definitely you can expect the question in your exam from this electrolyte imbalance and the digoxin sensitivity. You can expect question from this part as well. Okay, in what kind of situations digoxin is contraindicated? You don't need to memorize everything, but the heart block patients, supraventricular tachycardia with accessory pathways, in that situation also we cannot give the digoxin. But if you cannot remember, it's okay. Okay, you don't worry too much about memorizing each and every contraindication points. Definitely you have to remember this ventricular, because digoxin is not recommended in ventricular tachycardia or ventricular arrhythmia. This is the common side effect associated with the digoxin. That's why digoxin is only used for atrial arrhythmia, not the ventricular arrhythmia. Okay, supraventricular word you have to remember, supraventricular, that means atrial arrhythmia. Okay, hypertrophic obstructive cardiomyopathy, cor pulmonale, in these situations digoxin should not be used. Okay, now drug interaction, definitely you are going to get questions from this part. Drug interaction, broadly you understand like this. Digoxin is slow down the heart rate. So other medications that causing the bradycardia, if combining with the digoxin, that can cause arrhythmia. That is the one kind of drug interactions you can understand. Second is the medication that can cause the electrolyte imbalance. This electrolyte imbalance is indirectly change the digoxin sensitivity, and that can cause a problem. Another drug interaction is digoxin. Majority of the digoxin, 70% of the digoxin is excreted unchanged. Okay, so renal functionality and renal filtration change, that also cause the drug interaction with the digoxin. Another important point is certain cardiovascular medications like amiodarone. This is also very important medication for your arrhythmia. So when the digoxin and amiodarone, these two medications taken in a combination, in that situation that significantly increase the digoxin level. Amiodarone significantly increase the digoxin level. That's why the digoxin dose need to make 50% while the patient is start with the amiodarone and stabilized on digoxin, or vice versa. Okay, if patient is taking digoxin and if you start amiodarone, always you have to reduce the dose of digoxin and gradually you have to titrate it. For example, patient is taking amiodarone and new medication of digoxin you start with the lowest possible dose and gradually you can increase. Okay, why this combination is very important for exam point of view? Because amiodarone is most common. Amiodarone is most commonly prescribed medication for arrhythmia, and digoxin is also widely prescribed. That's why this combination is very important. Okay, now the second combination is quinine or quinidine. This medication is also used for arrhythmia, and digoxin is also used for arrhythmia and heart failure. So in the similar way, quinine is also increase the digoxin level. That means when the patient is taking this combination, always we have to decrease the digoxin dose. These are the most important drug interaction related point. Why digoxin is important for drug interaction? Because low therapeutic window, very narrow therapeutic window, very narrow, 0.8 to 2 microgram per liter. This is the very narrow therapeutic window. That's why we have to be very careful. If something goes wrong, immediately medication plasma concentration cross the toxic level. Okay, so these are the possible ways of drug interaction related points you have to keep in mind. And also inhibit and induce the peak glycoproteins, so digoxin concentration will be changed. So digoxin and drug interaction is another important concept that you have to keep in mind. Renal, okay, 70% of the digoxin is eliminated renally uncleared, wo unchanged, cleared through the renal. Dose reduction is required in renal impaired patients, खास करके mainly elderly patients that reduce the renal clearance, and that's why that's change the plasma concentration and also increase the sensitivity. So the dose adjustment is very important in elderly patients. In pregnancy and breastfeeding, mother can be given, but always we have to be very careful because the fetal arrhythmia can happen. Okay, adverse effect, narrow therapeutic range, more than 2 microgram per liter, that cause toxicity. So this limit you have to remember about digoxin, and toxicity possible even at the lower dose, especially in elderly patients or electrolyte disturbance patients. Why? Because the electrolyte disturbance patients, the digoxin sensitivity is significantly increased. So the lower dose is also causing the toxic effect. And the most common toxicity symptoms, digoxin toxicity symptoms are like this: anorexia, nausea, vomiting, diarrhea. Anorexia, nausea, vomiting, diarrhea, GI related all the points. Visual disturbance, drowsiness and dizziness. Okay, bradycardia, arrhythmia, headache. So these are the most important common symptoms about the digoxin toxicity. Digoxin toxicity. So in your examination, might be they are going to ask you the questions like all of the followings are the symptoms associated with the digoxin toxicity except, and might be they cause the constipation. This kind of point they can ask in the exam. So you should have to understand anorexia, nausea, vomiting, diarrhea, visual disturbance, drowsiness, dizziness, bradycardia and arrhythmia. Okay, so these are the most common symptoms. DZ-Fab, what is the most important substance that used for digoxin toxicity? Digoxin toxicity can be managed by fragmented DZ-Fab, digoxin fragmented antibodies. Okay, so that is directly neutralizing the digoxin and minimize the effect. This is the most common side effect. This is the infrequent side effect. Infrequent side effects like depression, shorten the QRS in your ECG change. Okay, atrial tachycardia, AV blocks, so cardiovascular arrhythmia. In general term, you can define the digoxin toxicity in two parts. One is the ECG change and other one is no ECG change. Okay, if the ECG change, that means that is a severe problem, and no ECG change means we can manage reasonably in a comfortable manner. Okay, and very rare is thrombocytopenia, seizure, confusion, psychosis and gynecomastia. Okay, so digoxin toxicity and the digoxin's adverse effect. This is another important point that you have to keep in mind. In normal situation, digoxin is not required loading dose. Normally patients start building up the plasma concentration and achieve steady state concentration in 7-8 days. But if required loading dose, oral loading dose is comfortably okay. Now you have to remember digoxin dose related questions might be they can ask in the exam. 62.5 microgram, 62.5 microgram to you can go up to 250 microgram. This is the normal range, okay, and 62.5 to 125 microgram. This is another normal range. The patients are taking the medications, but you have to remember the maintenance dose. Okay, maintenance dose, adult 125 to 250 microgram, elderly patients 62.5 to 125 microgram. So you have to remember the range between 62.5 to 250 microgram, not milligram. You don't make a mistakes. Okay, and you are not going to memorize each and every part of the dosing regimens. Renal impairment, you make it 50%. Okay, so that is become pretty easy. In normally in children's is a rule of thumb. Okay, for example, if you are giving to the pediatric dose 5 to 10 microgram per kilogram per day, but the total dose is exceeding the adult maximum dose, then you cannot give it to the adult maximum dose से ज़्यादा नहीं दे सकते हो. Okay, so wherever and whenever the pediatric dose calculation, when you are doing this kind of calculations like 5 microgram per kilogram per day, and for example if the calculation is exceeding the maximum dose of adult dose, then you are allowed to take the maximum adult dose. You cannot exceed the maximum adult dose. Okay, so this is another important point that you have to keep in mind in a general terms. Okay, TDM, therapeutic drug monitoring. You can expect question from TDM in digoxin. Steady state concentration, normally that take about 7 days time, half-life is about 36 hours. Okay, this is, so many times they have asked these questions. Blood sample timings. What is the meaning? For example, if you have taken a medication at 1 o'clock in afternoon, so at least you have to wait for 6 hours to get the sample. So 1 o'clock in afternoon, that means at about 7 p.m. you can take the blood sample. Why? Because in 6 hours medication is properly distributed and is evenly distributed in the body. So when we are taking the plasma samples, that is going to represent the proper distributed concentration. Okay, so these 6 hours, this another factuals that you must have to remember. Now the therapeutic range is 0.5 to 2 micrograms per liter. Okay, consider the lower range is this. In specific conditions like atrial fibrillations and this kind of situations, and if you are going to select the medications, you be very careful about that. But this another point, 2 microgram per liter से ज़्यादा concentration होती है. When the concentration is exceeding 2 microgram per liter, then there are likely to get the toxicity of the digoxin. And the toxicity is bifurcate or divided into two groups. One is the ECG change and non-ECG change. Administrative advice, when given the IV, you can give it slowly and that take more than 5 minutes time. That's compatible with all different kind of solutions like a normal saline. This is normal saline in 5D glucose and the glucose saline. It shouldn't be any problem. Avoid intramuscular because the local irritation could be the side effect. Okay, inform doctor or pharmacist you are taking the digoxin, because digoxin has so many drug interactions associated with it, so you have to be very careful. Normal practice points, renal function and electrolytes need to be checked, because that's a 70% digoxin is eliminated renally and electrolytes change the digoxin sensitivity. Okay, onset of action, you can expect the maximum effect in 6 hours time. That means what? The patient is taking the medication in 6 hours, the properly distributed in the body, and after that if we are taking the sample, that is going to represent the proper concentration of the digoxin in our body. Okay, and also the patients should have to monitor for the regular toxicity and the resting heart rate. Why resting heart rate are very important to monitor during that time? Because the resting heart rate, that is a representation of the arrhythmia. If the patient is ventricular arrhythmia is occurred or happened, in that situation we have to be very careful about that. Okay, these are the important points that you must have to understand about the digoxin. So what are the key points? First of all, indication and the mechanism of action. Two important mechanism of action, that's why that used for the atrial fibrillation and also used for heart failure. The second part is what is the side effects associated with the digoxin. Okay, digoxin toxicity, what is the plasma concentration, renal failure patients. Okay, then therapeutic drug monitoring, electrolytes and the effect of digoxin sensitivity, drug interaction. All these key points about the digoxins are very, very important to learn, and you can expect really good questions from the digoxin, because this is the most important medication. Okay, another medication, very small concept that we have to keep in mind is ivabradine. This ivabradine is used for the angina and heart failure. What is the mechanism of action? The ivabradine is slow down the depolarization of the ethanol. Okay, is depolarization. Ivabradine inhibit the current regulating the interval between the depolarization of the ethanol. That means that's a slow down the heart rates. Okay, that's why this medication is decrease the cardiac workload and myocardial oxygen demand. Okay, because the depolarization slow down, that means that decrease the cardiac workload and also that decrease the oxygen demand. That means this is the good medication for the angina. Okay, and also that medication is used for the stable chronic heart failure. But make sure if the patient is suffering from arrhythmia or low heartbeats, in that situation we cannot give this medication. Okay, this is the most important crucial point that you have to keep in mind. And also the similar kind of depolarization happening in the retina in our eyes, and due to that the blood vessel and phosphens. So this kind of side effects might be patient can experience. Okay, so here also depolarization change with the medication, and some of the patients can get this side effects. So ivermectin can be taken with the fruit, with the food, and avoid the grapefruit juice. So you have to make a list of the medications that should not be taken with the grapefruit juice. This grapefruit juice is not a grape juice. Grape is different and grapefruit is different. Okay, so grapefruit juice should be avoided because that's the metabolism competition, and due to that increase the plasma concentration of ivermectin, and that increase the risk of side effects. Okay, so this the eye related side effects, immediately contact your doctor. And also you have to inform the slow pulses indicating arrhythmia side effects, shortness of breath, that is another cardiovascular related problems, and also arrhythmia, dizziness, fatigue. So this kind of problems are indicating the slowdown of the cardiovascular ejection fraction, and that's why immediately need to contact the doctor. Okay, so ivermectin is very straightforward medication. Sometime might be you can get the questions, so it's okay. Monitor for arrhythmia, atrial fibrillation. Okay, another very unique medication, Verisigate. This medication is little bit different in the manner, okay, that stimulate the soluble. Okay, this is a soluble guanylate cyclase. So don't get into more confusion level. Understand, enhance the nitric oxide pathway. Okay, so there are so many medications used for the hypertension reduction and erectile dysfunction. That means vasodilatory effect, nitric oxide enhancement, that can cause a vasodilation. Okay, so Verisigate is indirectly vasodilatory medications. Now it's become very easy. Okay, this is a vasodilation, so that's improve the vascular function. Now the vascular function has been changed. That means that has yesterday we had discussed about the concept that's called this heart is connected with the blood vessels. Now these blood vessels become more dilated. Okay, so the left ventricle required less work, or that required less pressure to pump out the fluid from the left ventricle to the blood vessels. That means that decrease the afterload. So afterload reduction, again the heart is start feeling ease. Okay, so vascular functions and the afterload reduction. That's why this medication is considered as the alternative option for your heart failure patients, and indirectly improve the cardiac function and reduce the workload on the heart and improve the circulations. Okay, this is not because of the force of contraction. It's not a positive inotropic. That's a vasodilatory medication and afterload reduction. Okay, indication, sympathetic heart failure in ejection fraction is less than 40%. Stabilized patients we can use. Take with food. All hypotensive medications. Hypotensive medication can cause a light headache and dizziness. This is a very common. You can make it more generalized. All blood pressure reduction medications can cause these things. Avoid driving and using machinery while you are taking these medications. Symptomatic, okay, in case of symptomatic hypotension is there, and if patient is taking diuretics, might be the patient is more in hypovolemic situation, and that increase the risk of hypotension. Okay, so reduce the dose, that is fine. Okay, so these are the 3 important medications that you have to learn related to heart failure. Rest of the medications we have covered, and SGLT2 medications we are going to cover in diabetes. Okay, so I hope today's class can add value in your learning process, but the most important drug is Digoxin, and definitely you can expect couple of questions from the Digoxin. And if you are going to learn all these fundamental points, you will be good to go, and you are going to manage all the questions related to Digoxin. Okay, take care, have a great time, bye bye, see you.